MDCG have also been publishing alongside the core agenda. Their documents, although legally non-binding, do represent the state of the art, okay? And as the general safety and performance requirements in the regulation require manufacturers to comply to the state of the art, it's really important that we're all fully aware of the content of these and we take full account of what they're saying. So the first one is around Article 54. This defines the requirements for clinical evaluation consultation procedure. So for those of you who aren't overly familiar with this, the notified body will review your clinical documentation and prepare a clinical evaluation assessment report. And that assessment report, along with your documentation, will be sent to the European Commission, and then it will be sent to the appropriate expert panel for further scrutiny. This only applies to Class 3 implantable devices and Class 2B active devices intended to administer or remove medicines. Okay? The article goes into more detail around the timelines and the specific steps. The article also states, 54.2b, where the device has been designed by modifying a device already marketed by the same manufacturer for the same intended purpose, provided that the manufacturer has demonstrated to the satisfaction of the notified body that modifications do not adversely affect the benefit-risk ratio, you don't have to follow the CECP process. Okay? Now, under the MDR, there are no MDR devices currently marketed, okay, because it's new. So what they've been able to clarify was, although we initially understood there are no MDR devices marketed, so this would apply to every single device, it has now been clarified that a legacy device, if it's already marketed under the directives as a legacy device, and there are no modifications to the device other than that to meet the requirements of MDR, you do not have to go down the CECP process if you fall under the requirements of Article 54. So it's if you have an MDD device, and you're just going for like certification under MDR, CECP wouldn't necessarily apply. Okay, so that's a big change, whereas before it was understood that it would always apply. The other really important part around legacy devices is registration on EUDAMED. So all legacy devices, so covered by a directive certificate, have to be registered on EUDAMED, and the specific timelines have been mentioned. So assuming that EUDAMED is fully available on the date of application, you will have 18 months from that date of application to register your device on the database, all right? Except if you are subject to a significant vigilance incident or field safety corrective action, in which case you have to register your device immediately, okay? So that's the caveat. The other caveat that is defined in this document, if EUDAMED is not available, the timelines shift. So the timelines then shift to be 24 months from the date that the Commission confirms that EUDAMED is available. All right? So it's either going to be November 2021 or May 2022, depending on what goes on, potentially. The caveat applies in both circumstances. If you have a significant vigilance incident or a field safety corrective action, you must register your device straight away. Those of you who are familiar with EUDAMED and some of its preliminary functional specifications, it requires a basic UDI-DI and a UDI-DI to register. You don't need a basic UDI-DI and a UDI-DI for legacy devices. So EUDAMED will provide alternatives in that case. So we'll have a EUDAMED-DI and a EUDAMED-ID. Somewhat confusing, but that's what EUDAMED will generate. The exact mechanism for this hasn't been clarified just yet, but you won't need to apply basic UDI-DI and UDI-DI to your legacy devices. All right? So again, an important clarification to be aware of. With this document, it's the timelines that are critical for manufacturers. There's a lot of other activity. This is what we know today. This is what we're expecting to happen. So as we go through the rest of 2019, we should start to see the CND nomenclature coming through to standardize the terminology that we use under MDR. The standardization mandate, I'll talk a little bit more about that in a moment, but that will be formally issued, and that will lead to the first set of standards being harmonized against the MDR. The CECP expert panels will be constituted, the far late guidance will be published, and the MDCG working group set up, and we'll start to see the UDI issuing entities identified. So these things are going to be happening relatively quickly. As we get to the end of 2019, with the common specifications for IVD Class D should be available, and the final EUDAMED functional specification will become available. Moving into 2020, the EU reference labs should start to be designated. The common specifications for devices without a medical purpose will be published. And the EUDAMED go live is expected to be March 2020. So it's quite close to the date of application. That then leads us into the transitional periods with EUDAMED registration of legacy devices, as we just discussed on the previous slide, and then we get to the date of application of the IVDR as well. So there's quite a lot is going on, and obviously in the meantime, we all need to do conformity assessments and maintain our medical devices directive certificates as well. So there's quite a lot of activities going to be happening over the next few months. Other guidance documents will also be published. So we're going to start to see documents on PSURs and SSCPs, clinical evaluation coming through, classification and borderline manuals and guidance documents, and documents around software classification, qualification, and clinical evaluation. So there's a lot of activity. There's going to be a lot of publications and a lot of information that's going to become available. We all need to be very much aware of when this is coming out and stay on top of it, so we're all up to date on the requirements. You will need to know these things, and you will need to have accommodated for these things when you start to apply for conformity assessment under the MDR or IVDR. The gold star is where we are today. That's supposed to be today's date. This is the general knowledge on where we are today with harmonization of standards. The standards that you see on this slide now are the only ones that we've had a formal date published. If it's not on this date, it's going to be at the end of the validity period for MDD certificates. This is all in draft. The formal mandate has not yet been published, so we're waiting for that to happen. But this is the current knowledge of where we are today. There's a lot of questions around standards at the moment. The standardization request talks about the first group of standards and then has a long list of everything else for May 2024. We don't yet know for those standards that are still under development. So, for example, a new edition of 14971, 14155 is about to be published. Are they going to be harmonized, or will it be the current version that exists today? Will that be the one that's harmonized? We don't know. All right. What is important to note on standards is that in the absence of a harmonized standard, the normative text of the standards that are published today remains the state of the art. And it will now be up to the manufacturer, in the absence of an Annex Z, to build that gap analysis between the state-of-the-art standard and the requirements of the MDR. Okay, so that still has to take place, but you won't have the luxury of an Annex Z to point you in the right direction. But we'll still need to see that happen.